Assalamu alaikum everyone. Bringing you a very important topic regarding child abuse from the platform of PNMDP. My name is Dr. Aisha Sami, and today we're discussing some of the important key points with regards to history and examination, investigation, short and long-term rehabilitation of a patient of child abuse. My sources include the recent article published in American Academy of Pediatrics on the evaluation of suspected child physical abuse clinical report and Nelson 20th edition. So we all know that child abuse is defined as any recent act or failure to act on the part of a parent or caretaker which results in death, serious physical or emotional harm, sexual abuse or exploitation, or an act or failure to act which presents an imminent risk of serious harm to the child. It is very important to identify the risk factors that predispose a child to getting abused. So, if the child is emotionally or behaviorally a difficult child, or has chronic ailments, physical disabilities, developmental disabilities, or is an unwanted child, these factors would make him more prone to getting abused. Similarly, parental risk factors include a parent who has low self-esteem, poor impulse control, parents who do substance abuse, young maternal or paternal age, and parent abused as a child. Environmental and society-related factors include social isolation, poverty, unemployment, and a single parent, apart from others. So it's always important to think about child abuse in the differentials whenever a child is coming with suspected injuries like fatal injury from short falls. This kind of injury is fairly rare at a rate of 1 per 1 million young children per year. So, other than that, sentinel injuries like the ones we can find in the form of bruises or intraoral injuries, frenulum tears or fractures, these injuries are recognized as minor by the physicians and often overlooked when in fact they are the signs of abuse. So remember, absence of bookish features of injuries doesn't mean absence of abuse. These are some of the examples of sentinel injuries. This is a linear bruise behind the knee which could easily be overlooked, and the second picture is of finger imprints on the forearm of a young child. So the key points to remember in history is, firstly, we have to take the standard history including medical, developmental and social history. We have to rule out other important differentials, so we need to take history regarding bleeding or bone disorders, metabolic or genetic disorders in the family. Pregnancy history is very important, especially with regards to unplanned pregnancy or absence of prenatal or postnatal care or postpartum depression. Other than that, any history of substance abuse, any social and financial stresses. Remember, the best approach is to allow the parent or other caregiver to provide a narrative without interruptions, so the history is not influenced by the clinician's questions or interpretations. Now, the general physical examination suggestive of child abuse include all of these, but it is very important to remember the mnemonic 10-4 in this regard. This mnemonic is for the bruises that are of concern for abuse. So any bruising over the torso, ear, neck, or in a child who is less than 4 years of age or who is less than 4 months of age should be viewed with suspicion. Bite marks can be important evidence of suspected child abuse as well. Other than that, injuries to non-bony or other unusual locations such as over these 10 areas, TEN, these areas, they are very important. Injuries to multiple organ systems, and any injury to young preambulatory infant. So this is a pictorial uh, presentation of where to find the suspected injuries in a child who is 4 years and younger. And in an infant, you could see the entire picture is red. So any bruising anywhere can be a significant sign of abuse in an infant. Now, immersion or scald injuries are another very important form of abuse related injuries. So, immersion burns often result in typical patterns that give clues to mechanism of injury. So, the surfaces that are directly in contact with the utensil, they are usually spared, and those surfaces which are in opposition to each other, like the back of the knees, they are also spared. But these are very classic forms of child abuse injuries. Skeletal injuries might result as a result of shaking the baby vigorously. These usually happen in a colicky baby. For instance, the baby is crying for hours and the parent is irritated, and the parent started shaking the baby, and as a result, apart from the neurological manifestations that might occur, the the bony injuries could also result, like multiple rib fractures, fractures at the ends of the long bones. Now, how to go about with investigations? So, fractures can be evaluated with the use of skeletal survey. Remember, we can repeat skeletal survey in 2 weeks' time for high risk cases if initially we don't get any fractures. Also, single whole body films are unacceptable, and bone scintigraphy may be used to complement the skeletal survey. In order to rule out other important differentials, we can get the calcium, phosphorus, alkaline phosphatase, vitamin D, and PTH levels. We can get skin biopsy for fibroblast culture if you're suspecting osteogenesis imperfecta. Bruises are important to investigate as well with regards to child abuse. So, apart from getting the bleeding and coagulation profile, we can also get a skeletal survey for these babies, especially if they are non-ambulatory infants with bruises or toddlers with suspicious bruising. For head trauma, we should evaluate with the bleeding and the coagulation profile, and with regards to imaging, CT scan of the head would be the first line of investigation. For better definition of the injuries, one could get the MRI of the head and spine done as well, and for associated fractures, one could get a skeletal survey of the whole body. So the indications for obtaining a skeletal survey include all children who are less than 2 years of age with obvious abusive injuries, or those with any suspicious injury including bruises or other skin injuries in non-ambulatory infants. Infants and young toddlers with unexplained intracranial injuries including hemorrhage and hypoxic ischemic injury. Infants and siblings less than 2 years in household context of an abused child. Twins of abused infants and toddlers. So these last two categories need to be assessed as well. It is a multidisciplinary approach to a patient with child abuse. So, first and foremost, we need to treat any emergency medical problem that the child is faced with, and after that, help ensure the child's safety, often in conjunction with child protection services. It is very important to convey concerns of maltreatment to parents. Kindly but forthrightly. Avoid blaming, and know your national and state laws with regards to reporting of child abuse. And it's important to establish specific objectives and measurable objectives, and encourage family involvement, and seek support for the parents as well, and address their issues if they have any. And in the long term, it's a rather long term management where providing support, follow up, and review of progress, all of these are very important. So with this we come to the end of our presentation. We'll be back again with yet another important topic. So stay tuned to PNMDP. Thank you.